And we're back. HIMSS Day 3. We're going to be talking with David Finn. Here, come onto the screen. We're going to get cozy here.
Oh, I am there. I see
there
me
you
now.
are. Yeah, yeah. And so, David Finn, you describe yourself as a recovering CIO, and now you're with Symantec. Tell us what you've brought to the table for this company. A lot of our viewers are familiar with Symantec, but maybe not in the healthcare realm.
Yeah, most people recognize Symantec as their antivirus on their desktop, but Symantec has been in healthcare for many years. Several years ago, they created a healthcare vertical recognizing that there are special needs in healthcare. And about a year ago, a little over a year ago, we decided let's take our expertise around security and storage management and really try to help health IT and the CIOs in healthcare with some of our strengths in ways that are unique to healthcare's needs.
Okay, so it's not just antivirus for electronic medical records.
No, it is what I describe as the critical infrastructure. So it's high availability, it's failover, it's antivirus, storage and storage management, making sure all those clinical systems you need to take care of patients are up and running every day, every minute.
Okay. Now, a lot of hospitals have their own electronic medical records or some homegrown things. They've got a different PACS. They've got, they kludge together some kind of interoperability. How does Symantec fit into this? Do they force people to restart from the ground up, or do they adapt?
One of the beauties of Symantec is we are vendor agnostic, and by that I mean we don't care what hardware you've got. We really don't care what software or applications you're running. We just want to. We're designed to work with everything and keep that at the at the lowest level of the system and the application to keep it live and running.
Okay. I wonder if you've had some horror stories before and after stories with Symantec in some hospitals that have had either significant breaches or slow systems or something.
Well, after 20 years on the provider side, I have my own horror stories. But it's becoming more critical, and I think that's why it's important now with meaningful use, with the exchange of information. It's going to be more important. When you were on a hybrid record, you could convert to paper, you could go back to your paper chart. But as we get more and more electronic, that's harder to do. And if the electronic record is down, if you need access to medical images, you've got to be able to get them somehow.
How about in terms of streamlining access and streamlining resources? Does Symantec allow for like single sign-on or any of these systems?
We have a great single sign-on solution, which is really more than single sign-on. It's the single sign-on. It's the whole desktop virtualization. It's application streaming. So you really get more than just a single sign-on solution. It lets you do more, faster, more conveniently.
And then you don't have to remember a bunch of different passwords. How about a lot of, so I work in an emergency department. A lot of my colleagues love to chart from home. They love to access the medical record from home. Does Symantec make that possible?
This solution I'm talking about, we have a what's called Workspace Enterprise for in the walls of the organization, and a product called Workspace Remote. So if you're up early at home, you're looking at charts in the morning before you come in, you log out at home. When you get to your office and sign in, you're right back at the same patient at the same point in your session as when you left the house.
Oh, so it sounds a little more robust than what Citrix is offering.
It travels with you. Yep.
Yeah, that's pretty cool. So you can finish a note at home. Let me ask. Symantec has a easy interface for consumers, but if you were a health administrator or a physician in private practice, how would they approach it?
Well, you're going to make me talk about our new offering now, which is
funny.
Funny how that works. But we do have an offering, and I'll talk about the part real quickly that the CIOs like, and that is the storage. They get the storage headache off their plate. They get the capital costs of buying storage off their plate, and we move your image archive, your PACS images, to the cloud. And what we did is we said, well, if it's in the cloud, it's going to be real easy to share. And so with our security tools, we allow sharing beyond the walls of your organization. You don't have to have a VPN. You don't have to log into your physician portal. You can get to the images and the reports as long as you have an internet access. And the cool part of this is that the interface, and Dr. John Halamka has described it as social networking for doctors, but we took the Google research, search engine and coupled it with a YouTube interface. So every time we've demoed this for a physician, they've literally grabbed the desktop from us and said, I want to do that. It's completely intuitive. It's what they're used to seeing on social networks, and they can get to their patients quick. Wow. The study, the site, whatever they want to look by.
Yeah, I got to see how that looks. You have a booth, I guess, and display here?
Absolutely. Booth number 1249, and we will be happy. In fact, I'm going to take you right after the interview. We'll show you.
Let me ask you, because you're batting 1,000 so far. Is there, now I do some work with health information exchange. Does Symantec filter the data, or at least facilitate that procedure, health information exchange, getting other hospitals to access another hospital's siloed data?
We don't want to be in the clinical space. That isn't our expertise. The EMRs do a great job of sharing discrete data. Where we come into that HIE arena is through the image sharing. Most of the EMRs don't do the DICOM images, your x-rays, your MRIs, scans. Those are big files. They're hard to move around. No one wants to store them. So we become an adjunct to that HIE via the image share offering.
Okay. All right, let's turn questions over to Dr. Val, who's monitoring our chat room.
First question is this a branded standalone network or embed to existing?
It is it's a public cloud for subscribers. So it's a single cloud on the internet in Symantec data centers. So anyone can access it if we've given them the access to it, or if the provider has granted access to a provider outside of their area to look at a specific image.
But I'm actually thinking the question might have addressed or might have asked about something you talked about a little bit before, about how Symantec can interact with existing, and how you said they're vendor agnostic. Is that?
Yeah, we come off the back end of your PACS, whatever it is. At this point we're speaking DICOM and HL7 for the reports, so we can talk to anything and then link back to any other system that can support those standards.
Okay. All right, more from Dr. Val.
So other than the social media look and feel, why do docs like it?
One of the experiences I had as a CIO in healthcare is we had a lot of community docs or referring docs who would get the letter back from the hospital or from the specialist, but they wanted to be more involved. I was at a pediatric institution. They wanted to show the kids what the scans or images look like. This allows them to do it without 20-minute downloads or having to log into a separate PAC system or print pictures and bring them in. So there's a lot of cool factor, but there's also a lot of care factor around it. I think that's why the doctors like it.
I got to ask a little bit more about this social media kind of interface. Is it beyond just searching for patients? Does it help you with sorting medications, or finding, can you do some analytics and quickly find out how many of your patients are friends with Ambien or something like that?
Well, I'm not sure we can do the Ambien thing, but the power of the search engine is you can search by whatever you want to look at. We have some clickable items that that would be fairly standard, but if you were going in a different way, you kind of define that search and what you're looking for. So that's kind of the beauty of it. You can go in some standard ways. You can go in a customized way.
Okay. There you have it, Symantec.com/health to learn more about Symantec, a familiar name, but in a new kind of application for healthcare. Thank you very much, David Finn, for having us.
Thank you.
All right, the recovering CIO. I like that. All right, and we'll be back with more in just a moment.